Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear an optometrist talking to a patient named Mr. Stevens. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Stevens. Good to see you today. How can I help you?
Hi, Doctor. I think I may have the flu. I've been feeling awful for a few days now.
I'm sorry to hear that. Let's go through what you've been experiencing to get a better picture. Could you describe your symptoms in detail?
Sure. It started with some chills and muscle aches a few days ago. Then I developed a fever, and I've been coughing and feeling very tired since then. It's really wiped me out.
Sounds like you're dealing with quite a bit. Are you experiencing any other symptoms, like a sore throat, nasal congestion or headaches?
Yes, actually. My throat is sore and I feel congested. My head hurts on and off too. Breathing feels a little strained, especially with the coughing.
It sounds like you may have influenza, or the flu, as you suspected. This is a respiratory illness caused by the influenza virus and is quite common this time of year. Have you had any known exposure to anyone sick with similar symptoms?
Yes, my coworker was out sick last week, and I suspect it might have started with him. But I wasn't too worried because I felt fine then.
It's very possible, as influenza can spread quickly in close contact settings like workplaces. The symptoms you're describing are quite typical: body aches, fever, fatigue, cough and congestion. Are you currently taking any medication to help with your symptoms?
Just over-the-counter stuff. Ibuprofen for the fever and body aches, and some cough syrup. I haven't seen any big improvement yet, though.
That's good to hear. Over-the-counter medications can be helpful in managing symptoms. Typically, influenza will run its course within a week or 2. However, it can be intense and quite uncomfortable during that time, as you're experiencing. Do you happen to have any underlying health issues like asthma or diabetes?
No, I'm usually pretty healthy. I just haven't felt this bad in years.
That's good to know. Healthy individuals usually recover without complications, though the flu can certainly feel miserable. There are antiviral medications available that can shorten the duration of symptoms if taken early on, usually within the first 48 hours of symptom onset. Given where you are in the course, though, these may not be as effective now.
So, it's probably too late for that? Anything else I can do to speed up recovery?
At this stage, the best approach is supportive care. Continue with ibuprofen for the fever and aches, and keep taking the cough syrup if it's helping. I also recommend drinking plenty of fluids, water, tea, clear soups, anything to keep hydrated. Rest is essential as well, as your body needs energy to fight off the virus.
I've been trying to stay in bed as much as possible, but it's hard when I feel so uncomfortable.
That's understandable. It can help to take small, frequent breaks, especially to stretch or walk around a bit if you're able to. For congestion, a humidifier or hot shower can sometimes relieve nasal blockage. And if the sore throat is bothering you, gargling with warm salt water a few times a day can provide relief.
Good to know. What about being around others? My partner is worried about catching it from me.
That's a valid concern. Influenza is contagious, primarily spread through respiratory droplets from coughing or sneezing. To protect those around you, it's best to isolate as much as possible until you're fever-free for at least 24 hours without medication. Wearing a mask when near others and practicing good hand hygiene will also help.
Got it. I'll do my best to keep some distance then.
Great. Another preventive measure is cleaning commonly touched surfaces, like doorknobs, handles, and remote controls, especially if others in your household are healthy. Using a disinfectant can reduce the chances of passing it on.
I didn't think of that. I'll get on it.
Excellent. Also, I'd like to encourage you to consider getting the flu vaccine in the future, especially during flu season. While it doesn't guarantee immunity, it does significantly reduce the risk of contracting the virus and can lessen the severity if you do catch it.
I didn't get it this year, but maybe I will next time.
Sounds like a good plan. Vaccination is particularly important for those around young children, elderly family members, or anyone with a chronic illness, as it protects both you and them.
I'll keep that in mind. So, for now, just keep taking it easy, stay hydrated, and wait it out?
Yes, exactly. And if you notice any worsening symptoms, difficulty breathing, chest pain, or severe dehydration, please don't hesitate to seek immediate care. These could indicate complications that require medical intervention.
Thanks, Doctor. I'll watch out for those.
You're welcome, Mr. Stevens. Rest up, and don't hesitate to reach out if you have any concerns as you recover. Take care.
Extract 2, questions 13 to 24. You hear a GP talking to a patient named Mrs. Lee. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Lee. I understand you've been experiencing some itching. Can you tell me more about what's been going on?
Yes, it's been going on for a couple of weeks now, mostly at night. It's so uncomfortable that I can't get a good night's sleep anymore. I've noticed some small red bumps too.
I see. That sounds frustrating. Can you describe where the itching is most intense?
It's mainly on my wrists, between my fingers and around my waistline. I thought it was maybe a rash, but nothing seems to be helping.
Understood. And are there any other areas that itch, or any spots that look different?
Well, I've seen similar bumps on my elbows, and recently my husband started itching as well. I'm worried this might be something contagious.
That's very helpful information. Based on your description, it's possible you may have scabies, which is a common skin condition caused by tiny mites that burrow under the skin. The itching can indeed become worse at night.
Scabies. I've heard of it, but didn't think I could get something like that. Is it easy to treat?
Yes, we can certainly treat it, but it does require some specific steps. Scabies is indeed contagious. As you mentioned, your husband now has symptoms. Treatment generally involves applying a topical cream or lotion that kills the mites, and we may also recommend treating other household members to prevent reinfection.
So, will this cream get rid of the mites completely?
Yes, it's very effective. You'll apply it all over your body, from the neck down, and leave it on overnight. In the morning, you can wash it off. We'll likely repeat this a week later to ensure all mites are killed, including any newly hatched eggs.
All right, that doesn't sound too bad. Will the itching stop right away?
The itching may persist for a bit, even after the mites are gone, as your skin might still be sensitive. I can prescribe an anti-itch medication or suggest over-the-counter options to help with this.
Thank you. And what about cleaning our home? I've read that mites can live on surfaces.
That's a great question. Scabies mites don't live long away from human skin, but we do recommend washing all bedding, clothing and towels in hot water and drying them on a high heat setting. For items that can't be washed, sealing them in plastic bags for at least 72 hours can also help.
So, Do I need to clean my mattress too?
Generally, it's not necessary to clean the mattress, but vacuuming and wiping down surfaces where you may have direct contact, like your couch or bed frame, is a good precaution. Scabies mites can't survive for more than a few days without skin contact.
I see. And should I be worried about passing this to anyone else?
Scabies spreads primarily through prolonged skin-to-skin contact, so casual contact like a quick handshake isn't typically a concern. But close contact, like living in the same household, makes it easy to pass along, so I'd recommend that everyone at home apply the cream as a preventive measure.
That makes sense. I'll talk to my husband about it too. Thank you for explaining everything so clearly.
My pleasure. I'll write out the instructions on how to use the cream, and we'll follow up in a week or two to ensure the symptoms are gone. In the meantime, don't hesitate to reach out if you have more questions.
Thanks so much, Doctor. I feel a lot more at ease now.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 maternity care supervisors discussing the importance of cultural sensitivity in maternity services. Now read the question.
It seems like some of our staff members are struggling to provide culturally sensitive care, especially when a patient's beliefs or traditions don't align with medical recommendations.
That's definitely a challenge. Have we provided staff with any resources on this?
We've shared online guidelines and even held 2 training sessions, but it doesn't seem to be enough for everyone to feel confident in these situations. I think we should address this in the maternity staff meeting next week.
Is that scheduled for Friday morning? Will everyone be able to attend?
Yes, it's on the calendar for all staff. If anyone can't make it, we can arrange to speak with them individually to make sure they're comfortable with these practices.
Now look at question 26. You hear members of a hospital ethics committee discussing ethical considerations in emerging medical technologies. Now read the question.
Diagnostics, CRISPR gene editing, and brain-computer interfaces, we're entering complex ethical territory. For instance, in diagnostics, AI tools offer powerful insights, but we need strict protocols to ensure they align with patient safety. We've been awaiting approval for guidelines on AI use, but there's been a delay in the legal review process. This means we're currently unable to implement the tools fully as we're waiting for legal clearance.
Now look at question 27. You'll hear a dietitian discussing dietary adjustments with a patient. Now read the question.
So, Mr. Taylor, you've been dealing with persistent digestive discomfort, correct?
Yes, it's been bothering me for weeks now. I often feel bloated and constipated, and it's quite uncomfortable.
That sounds challenging. To help with your symptoms, it's essential to make some dietary changes. Have you tried incorporating more fiber into your diet?
Not really. I didn't think it would make much difference.
It can be very beneficial. Increasing your fiber intake can help ease constipation. Also, if you continue to have issues, a gentle laxative might be necessary to provide some relief. I'd recommend starting with whole grains, fruits, and vegetables to see how your body responds.
Okay, that makes sense.
Great. Let's focus on making those changes and see how you feel over the next couple of weeks.
Now look at question 28. You hear a trainee nurse discussing with a mentor. Now read the question.
Hello Maria, I have a case I'd like to discuss with you.
Of course. Tell me about it.
I'm seeing a 4-year-old girl in the pediatric outpatient clinic. She's been having recurrent asthma attacks over the last few months, and her parents brought her in today because she's been experiencing shortness of breath almost daily. They mentioned that she's been waking up at night due to coughing and wheezing, and it's affecting her activity levels. I've done a physical exam, and while her oxygen levels are stable, her breathing is clearly labored, especially during exertion.
What are you thinking as a working differential diagnosis for her current symptoms?
I'm considering a few possibilities, such as poor asthma control due to inadequate medication or technique, environmental triggers at home, or even an underlying respiratory infection. There might also be concerns about the family's understanding of her asthma management plan.
Good thoughts. So, what steps do you plan to take next? Now look at question 29. You hear a training session on the effect of stress and anxiety. Now read the question.
Today, we're going to explore how stress and anxiety can affect an athlete's performance and overall mental wellness, particularly in high-stakes competition environments. Mental health professionals play a significant role in supporting athletes and their coaches by conducting thorough mental health assessments and providing strategies for managing stress before, during, and after competitions. We'll begin with a case study focusing on an athlete named Sarah, who recently faced a series of high-pressure events. She noticed increased anxiety and difficulty focusing during her training sessions leading up to competitions. After evaluating her needs, we determined that implementing mindfulness practices and improving her sleep hygiene could significantly improve her ability to manage stress. Additionally, regular sessions with a sports psychologist were recommended to develop coping strategies for long-term mental resilience.
Now look at question 30. You hear a researcher talking to a patient. Now read the question.
Treatment, Mrs. Lang?
A bit tired, honestly. But I think it's working because I don't have as much bloating as before, like you said might happen.
That's normal. Some people feel a bit fatigued initially as their system adjusts. But overall, it's a good sign. We're targeting your microbiome to help balance your gut health. You're really on the forefront of new treatment approaches here.
Oh, that's exciting. I'd read a bit about the microbiome before, but it's fascinating how quickly you can feel a difference with it. It's still amazing to think how much it can influence other things, like my immune system.
Absolutely. As your microbiome becomes more balanced, you might see benefits beyond digestion, potentially even for your immune response. Just be sure to stick to the plan. And let's check in next month.
Next month? After I started, I expected to feel better in a week or two. But I guess patience is key with these things.
Exactly. When it comes to microbiome health, the body often takes time to respond.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, You'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an orthopedic surgeon giving a detailed presentation on latest innovations in 3D printing technology for orthopedics. You now have 90 seconds to read questions.
Hello everyone. I'm Dr. Moore, an orthopedic surgeon and researcher at Stanford University Medical Center. It's a pleasure to be here today to discuss the latest innovations in 3D printing technology for orthopedics, specifically in creating customized prosthetics. This research represents an exciting advancement that I believe will truly reshape patient care and recovery outcomes for those who require prosthetic limbs. Just to give you some context, prosthetics have traditionally been made with pre-sized components, which means they often require adjustments or even replacements over time as the patient's body changes. For example, a prosthetic leg that fits perfectly today might not be as comfortable 6 months later. This lack of personalization can lead to discomfort, limited functionality, and in some cases, extended rehabilitation. However, with 3D printing, we're able to create prosthetics tailored specifically to each patient's unique anatomy. This approach is transforming how we think about prosthetics because it allows for better comfort, increased mobility, and a quicker recovery process. The way we use 3D printing to design these prosthetics starts with a detailed scan of the patient's limb. These scans allow us to capture the exact measurements and contours, ensuring a precise fit. Based on the scan, a digital model of the prosthetic is created. This model can then be modified to accommodate specific needs, such as extra cushioning in areas where the patient might have scar tissue or sensitive skin. After the model is finalized, we send it to a 3D printer, which constructs the prosthetic layer by layer using strong yet lightweight materials. The end product is a prosthetic that fits like a glove, providing a personalized experience that simply wasn't possible with traditional methods. One of the most remarkable aspects of 3D printing technology is that it allows for rapid prototyping. We can quickly make adjustments and produce new prosthetics as needed. For growing children who need frequent size changes, this is incredibly beneficial, as it allows us to create new prosthetics in a fraction of the time compared to conventional methods. This technology also enables us to quickly test new designs, allowing for continuous improvement and refinement of each prosthetic. A major challenge in the field of prosthetics is balancing strength and weight. Traditional prosthetics can be quite heavy, making them cumbersome and difficult to use. With 3D printing, we can use advanced materials like titanium and specialized polymers, which are lightweight yet extremely durable. This means patients can be more mobile and experience less strain on their bodies. Additionally, the personalized design process allows us to distribute weight more evenly, which helps prevent injuries and improves comfort during extended use. Privacy and data security are paramount in this process. Each prosthetic design begins with a scan of the patient's body, so protecting this information is a key concern. We use secure data handling methods to ensure that these scans and patient information remain confidential. Patients have been very supportive of this technology, but it was important to assure them that their data would be handled safely and responsibly. Some people may wonder if 3D printing means that machines will take over the role of medical professionals in designing prosthetics. The answer is no. While 3D printing is a powerful tool, it still requires the expertise of skilled orthopedic specialists to interpret scans, design the models, and oversee the entire process. The technology supports our work by enabling us to be more precise and efficient. This ultimately means that we can focus on more complex cases and provide more personalized care to each patient. While our research is focused on patients here in the United States, we're also exploring opportunities to collaborate with international partners. By working together with medical institutions around the world, we can refine and improve 3D printing techniques, ensuring that patients globally benefit from this technology. This collaboration is especially valuable in countries with limited access to traditional prosthetics, as 3D printing could offer an affordable, accessible alternative. Thank you all for your attention. I'd like to extend my gratitude to my research team and to the organizations that supported our work. I'm excited to see how 3D printing will continue to evolve and make a meaningful difference in the lives of our patients. Now, I'd be happy to take any questions you may have.
Extract 2. Questions 37 to 42. You hear a conversation between a director and travel medicine specialist. Now, read the questions. You now have 90 seconds to read questions. Good afternoon. It's nice to meet you. I understand you're planning a trip?
Yes, I am. I'll be heading to Southeast Asia next month for about 6 weeks. I'll be visiting several countries, and I'm hoping to spend a lot of time outdoors, maybe even some hiking in the forests and mountains.
That sounds amazing. Southeast Asia is a fantastic region, but it's important to take a few health precautions before you go. Vaccinations and travel health advice will help you make the most of your time there.
I've heard that certain vaccines are required for some countries. I'm honestly not sure what I might need.
It's good you brought this up. Different countries have different vaccination requirements. First, you'll need to be up to date on the routine vaccines like MMR, tetanus, and flu, as some places have higher incidences of these diseases.
I've had most of those, but it's been a while. I think my last tetanus shot was over 10 years ago.
We'll make sure you're covered. For travel to Southeast Asia, in particular, we need to consider vaccines for hepatitis A and typhoid, as these diseases are common in areas with lower sanitation levels. You'll likely encounter them through contaminated food or water, especially if you're trying local foods, which I highly recommend.
I definitely want to try as much local food as I can. Are there any other specific health risks I should know about?
Yes,
If you'll be spending time in rural or forested areas, I'd also recommend a Japanese encephalitis vaccine. It's not common among travelers who stick to urban areas, but because you plan to hike and be outdoors, it's a good idea. The disease is transmitted by mosquitoes, especially in areas near rice paddies or water bodies where mosquitoes thrive.
Wow, I didn't even think of that. So, Japanese encephalitis is a big risk?
It can be, especially for those spending extended time outdoors in rural areas. The vaccine can reduce that risk. And speaking of mosquitoes, we should also discuss malaria, which is present in parts of Southeast Asia. There's no vaccine for malaria, but there are medications you can take to prevent it. Since it's hard to predict exactly where malaria is found, many travelers take anti-malarial medication as a preventive measure, especially if they're going to rural places.
Do I have to take the malaria medication every day?
It depends on the medication prescribed. Some need to be taken daily, and others just weekly. We can discuss which option might work best based on your travel schedule and any potential side effects. It's also smart to pack mosquito repellent and wear long sleeves and pants, especially in the evenings when mosquitoes are more active.
I'll make sure to pack plenty of repellent. Are there other general tips to help me stay healthy on the trip?
Absolutely. One common issue travelers face is foodborne illnesses, which can often cause stomach upsets. Stick to bottled water and be cautious with street food, especially if it doesn't seem freshly prepared. I also suggest you carry oral rehydration salts and antidiarrheal medications as a precaution. And of course, wash your hands often or use hand sanitizer to reduce your risk of getting sick.
I'll keep that in mind. Are there any other vaccinations I should consider?
Since you're traveling internationally, some countries may check for proof of a yellow fever vaccine, if you're coming from a region where it's common. Also, rabies can be a risk in some parts of Southeast Asia, especially if you plan to be around animals or in rural areas. It's usually not required, but it's something to consider based on your planned activities.
I hadn't thought about rabies. Is it worth getting vaccinated?
If you'll be in close contact with animals, it can provide peace of mind. Southeast Asia has a significant population of stray dogs, monkeys, and other animals that could carry the disease. If bitten or scratched, you'd need a series of shots immediately after to prevent the disease from developing.
Thanks for all the information. I feel much more prepared now.
Glad to hear that. Once you're vaccinated and have any necessary medications, you'll be well on your way to a safe, healthy trip. Just remember to enjoy yourself and take precautions when needed. That is the end of Part C. You now have 2 minutes to check your answers.